Recent studies show that 15 to 40% of cancer patients present with signs of malnutrition at diagnosis, and 40 to 80% of all the cancer patients usually develop some signs of malnutrition throughout their treatment procedures. My name is Lilian Momina. I am a registered clinical nutritionist, and in today's video we're going to talk about why cancer patients usually develop malnutrition throughout their treatment course. So the first thing that you need to understand is that cancer is a highly catabolic condition. This simply means that it has high nutrient demands. And you see, when you have cancer and you're not taking care of that nutritional intake to ensure that you cater for those increased demands, you're definitely going to develop malnutrition, that is basically cachexia, and catabolism, that is a common characteristic of cancer patient. The second reason that you will develop malnutrition if you have cancer is due to the side effects of the cancer itself or the treatment options of cancer. Maybe nausea, vomiting, diarrhea, change in the senses, your taste bud changes, your smell changes, and all these affect and influence food intake negatively. And you will definitely have more nutrient losses, and this will definitely predispose you to malnutrition if it persists for long. It is important again to make sure that you report effectively on the side effects that you are experiencing from the cancer or the treatment options that they have given you, so that they can actually assess how much nutritionally at risk you are, so that they can give you optimum and good plans that are going to cater for your nutrition needs. Malnutrition has been associated with faster progression of the cancers. You are more likely to get from stage 1 to stage 2 of cancer if you have malnutrition than if not. Another thing, malnutrition also slows down how the patient effectively adapts and takes up the treatment procedures. So it is an important aspect of care in cancer, especially if you want to recover faster. The third thing that will cause malnutrition in cancer patients is usually the mental effect of the disease itself. It's a whole condition that you're being bombarded with, and we are human beings, so it will definitely give you stress. We have a characteristic that cuts across all African people. Like, if you're diagnosed with a condition that needs more care, you're probably going to hide it from people that care about you in the name of protecting them. And you see, you yourself, you need the moral support, you need the adequate care, then you avoid all that. What will happen? You'll continue dealing with the stress alone, all the anxiety, all the worries, all the questions alone. It's not a good thing. Some people resort to low food intakes when they have stress, and you combine all these stressful conditions with the side effects associated with the disease, will definitely affect your food intake, which is supposed to be really well planned to high levels to ensure that you're not undergoing too much catabolism to prevent the occurrences of malnutrition in cancer. The fourth reason why a cancer patient will develop malnutrition is basically attributed to the localization or the position of the cancer. Some cancers usually affect nutrition status more than others. For instance, if you have cancers that affect the feeding or the digestion tract, something like the esophageal cancer or the throat cancers, or even the mouth cancers, or even something like the stomach cancers, all these are going to affect nutrition uptake and absorption and utilization, and it will definitely compromise your nutrition status more than someone who's suffering from breast or prostate cancer, or even cancers that do not affect the digestion tract. It is easier to optimize oral feeds to tackle nutrient demands than using other forms of feeds. If you have the cancers at locations where they are going to affect nutrition intake, uptake, and absorption, other forms of feedings are going to be initiated. We have enteral and parenteral feeds for those patients or for those people who cannot feed orally or who cannot take up to 50% of their nutritional requirements through their mouth. So you need to have a sit down with your physician, your dietitians, and talk about how you're feeling. Be very honest with your feelings and how they are actually affecting your food intake. It is very important because only this data can actually help you to ensure that you're actually being taken care of and you're being provided with the actual good and adequate care that you actually need. Because again, timely and adequate nutrition interventions have been shown to improve outcomes in all cancer patients, regardless of where the cancer is located at. If your nutrition status is taken care of at diagnosis, you have a dietitian to work with you throughout the treatment procedures. When the side effects are coming up, you have someone to adjust your nutrition plans, because again, you have to make sure that you're adjusting with need. Apart from the parenteral and enteral feeds, we also have therapeutic and supplemental foods. Again, we also have supplements that can be planned and prescribed for patients. It is also important that when you're going to your dietitian, you give them a clear history, a food history in relation to lifestyle, in relation to need, medication, and how you're doing, so ensure that they also capture the right information to optimize and ensure that you have a plan that is going to take care of your specific needs. And if you don't have the cancer, make sure that you watch this video right here on how to prevent cancers, because again, more than 50% of all the cancers can actually be prevented with actual lifestyle adjustments. So let's meet there.